Colleagues, I rise in this very early morning to express my deep opposition for Senate Bill 1198. First, I want to start with a question. Did you know that every single one of Michigan's 83 counties has a dedicated veterinarian office? All 83 counties. Every single county. But nearly 1/3 of Michigan's counties do not have an OB/GYN. Do we really think the health and well-being of our four-legged friends is more significant or more urgent than the health and safety of the women in our lives? It's ludicrous. Supporters of this bill tell us that it's a safety issue. And if it were simply a safety issue, then why does the legislation single out these 2-pill abortion drugs and not the other 73 drugs that the FDA groups in a similar fashion? You know what I believe is a safety issue? It's ensuring that every woman has the freedom to access the safe, legal, medically necessary health care she needs when she needs it. Telemedicine and telehealth expand access to health care to every corner of our state, which is incredibly important to women in rural communities, and quite literally, women that have no other alternatives. This bill doesn't expand in-person health care. It doesn't address the ongoing doctor shortage facing our state. All this bill does is enforce obstacles to the safe reproductive health care that each woman and her family deserves. And it is safe. And that's not just my opinion. That is the conclusion of the American College of Obstetricians and Gynecologists, experts in the reproductive health care field. Study after study has shown that there is no medical or scientific reason to ban telemedicine-administered prescription-induced abortion. To claim that we should do so anyway is purely political. Every woman in this state has the legal right to decide for herself when and how to start a family, just like I did, 3 children. And that means having access to the comprehensive reproductive health care options she needs. This bill before us is nothing more than an attack on the health and safety of women who often may have no other alternatives. I will not support efforts that are more interested in legislating their version of morality on others than protecting the health and safety of Michigan's women. Restricting access to legal medical options and telling doctors which recommendations they are allowed to give will not make anyone safer. So I ask you, my colleagues, to join me in protecting the freedom of every woman in Michigan to make the private and individual medical decisions in consultation with her doctor, those decisions that are best for her. Let's not allow government to enter the doctor's office, but honor limited government that doesn't control my vagina. When will we finally trust women? I urge a no vote on House Bill 1198. Thank you, Mr. Speaker.